Pretty sure I would choose not to play that game. Criticizing other providers is a dangerous game to play, and I'm being lighthearted because it's not a game at all. It's a very sensitive area that once you get into healthcare, it's something that you should be prepared for no matter where you are, no matter what you do. Whether you are an entry-level nursing student or if you're an attending physician or a surgeon, doesn't matter. Across that entire spectrum, anyone that has to directly care for patients in some manner, doesn't have to be inpatient, can be outpatient, but if you are a healthcare provider, you are going to get this question sooner or later. And you're going to have a good answer. You should probably have some sort of evergreen cookie cutter answer that is safe. Safe as in it does not incriminate you and it does not give a negative portrayal to the patient about the person they're criticizing or you yourself. Do not make the mistake of trying to make yourself look good by making somebody else look bad, because then that actually kind of makes you look bad because you're willing to put down someone that you may or may not know, not fully understanding the scenario in which that patient is describing. Not out to make anybody a liar, not out to make anybody providing false claims. Also not excusing anyone from not doing the job that they should be doing. You simply need to answer them in a professional manner and state in some way that you can't speak to that particular scenario or that person because you were not present when that happened. And that saves you from judgment either way. And that is kind of the cookie cutter answer I give any patient. I do take care of a lot of patients who enter my facility and are under my care, who are visually and physically and verbally are upset with the care that they experience somewhere else. Somewhere else could be within my facility. It could be some other facility, could be a physician or an APP that they spoke with. This could have happened an hour ago, 3 hours ago, a day ago, a week ago, a month ago, a year ago. That does not matter. What matters is the way that you answer them. They are looking to you for answers as well as comfort. What matters is the manner in which you answer. The patient or the family member, could be anybody, they are looking to you for comfort and for answers and sometimes validation. They want to complain about something and they want you to agree with them. And until you agree with them, they're going to remain angry, upset, or unhappy in some way. And it's not your job to solve all their problems. It is your job to defend the system in which you work in. You don't have to agree with it, and it's surely not perfect. But how would you feel if when the patient you're caring for leaves and they did not agree with the care that you provided, so they go to the next provider at the next facility and they badmouth you? Yet you didn't intentionally do anything wrong. You feel that you provided the best care possible, yet they're going to be upset and feel like something was not done. And they're going to take it to somebody else. That's literally what happens when someone's complaining to you about another provider. You need to make sure that you explain to the patient or the person who is bringing this to your attention that you're very sorry that they feel the way they feel, and that things were not cared for in the manner in which they could have been. But you cannot speak to any of those activities, actions, or results because you were not physically present. Let's see how we can address them now. And you need to word that however you want. Those are the elements I use. I'm not telling you my exact words because, well, quite honestly, you're not stealing it. So you need to come up with your own. But quite honestly, the safest and most professional thing you can do is to make sure you tell them that you cannot pass judgment. You can't speak about anything that happened because you weren't physically there. So unless you were physically there and can recreate everything that happened, you are simply providing a uninformed opinion. And how would you feel if someone was talking about you to someone else and they provide an uninformed opinion about you?